Pre-recorded for West Kent Radio. Hello and welcome to Health and Wellbeing with Dr. Nadia Ramjohn here on West Kent Radio. I'm Mona Channet. Have you been forgetting words more often than lately? Feeling anxious for no clear reason or walking into a room and suddenly forgetting why you're there in the first place? Many women put these changes down to stress, burnout, or simply having too much going on, but could it actually be perimenopause? Joining me today is Dr. Nadia Ramjohn, a local NHS GP with a passion for women's health. She completed her DRCOG, a postgraduate qualification demonstrating advanced knowledge in women's health care whilst working in obstetrics and gynaecology at Tunbridge Wells Hospital. Today, she's helping us better understand the signs and symptoms of perimenopause that many women don't even realize they're experiencing. The information discussed in this feature is for general education purposes only and should not replace medical advice. Always check with your own GP or healthcare professional before acting on any information discussed. Hello, Dr. Nadia Ramjohn.
Good morning. Thank you. Absolute pleasure to be talking to you.
It's exciting to have you here on West Kent Radio because the buzzword perimenopause is really out there. But before we even go and talk about that, allow everyone to understand exactly who you are and what you specialize in.
My name is Dr. Nadia Ramjohn. I am a local NHS GP working rurally in a lovely practice. I also do a little bit of the GP in A&E roles, but that's more of an urgent care role. I also have an Wagyu cattle farm. I'm really engrossed in rural life now and a couple of children. So life is really busy.
Let's talk about perimenopause because not many people know what it is.
Yes. And it's absolutely really important that we talk about it and bring awareness to it. So what is the perimenopause? So the perimenopause is the time period before the menopause, when your hormones start really fluctuating with an eventual decline into the menopause. Now, this can happen up to 10 years before you hit menopause. So that's why it's so important to talk about it, because it can be such a long duration of symptoms.
That's incredible because I don't know many of my immediate friends who knew that it started a long time ago because you really don't get the symptoms. Can you explain a little bit about the symptoms? Because I'm not so sure that many are aware.
So I think the first symptom that a women talk to me about is that they just don't feel themselves. Everything else in their environment, in their life, they still have regular periods, or if they've got the Mirena coil, they don't have any periods at all. So everything else has stayed the same, but they just feel something is just not quite right in their lives. And they are performing at work and they are struggling and they're trying to complete everything that they've got to achieve, but something is just not right. And that can often be the first symptom of perimenopause. And then we can go into everything else that comes with it. And everyone talks about hot flushes and menopause. But in the perimenopause, we talk about more cognitive issues and decline. So we talk about our brain function. And one of the first things that I see as a local GP is anxiety. New onset anxiety in females who are so high functioning, so successful, never had any symptoms of anxiety in the past, and all of a sudden they are struggling with just carrying out simple tasks that they have done all their life. I had a patient who can't drive on the motorway. She said, I've driven all of my adult life, but all of a sudden I have this crippling anxiety to get on a motorway. I can't go on the M25. It brings me out in sweats. I start shaking. I can't do that. And it is not just anxiety. We have low mood. We have new onset depression. And then the biggest buzzword is brain fog. So as we talk about hormones and brain fog, estrogen is one of the reproductive hormones, but it also has major receptors in the brain. And that's where brain fog comes in, where we can't function and do the things that we used to be able to do with our eyes shut, walking backwards. We can't do those simple tasks now. Word finding, completing our sentences, walking into rooms. Why did I come in here? So that's really one of the major symptoms in the perimenopause. Imposter syndrome, that's another one that we feel that we've been completing tasks, doing our jobs, and all of a sudden we're anxious, worried that can we do this? How do I do this? So these are the cognitive symptoms that I'm seeing in women a lot earlier, and we're not aware. Why are we feeling like this? Why are we not able to do these tasks we've done for years? So that's one of the biggest symptoms that I see in the perimenopause.
That's incredible. I have to ask you a question that I would ask my GP. If I were going through any of those symptoms, when would I know to get a test to measure my hormones to validate whether or not I'm going through perimenopause, opposing to I'm just stressed out, I need to change a relationship, it's not the right job, I have too much on my plate? Because many people will throw targets at other instances rather than perimenopause.
We often say there's no reason to test your hormones because your hormones fluctuate so quickly and on a daily basis. So, to do your hormone blood test is not really very beneficial for us. We are diagnosing the perimenopause on your individual symptoms. So that's really important to mention. I think it's also important to mention that some of your symptoms of fatigue could be you're iron deficient or you're putting on extra weight. So could you be pre-diabetic? We do advise that if you're under 45, it might be worth going in and having a conversation with your family doctor and getting some basic monitoring bloods to make sure you're not anemic or there's not something else going on. But if you're over 45, they tend to say, just crack on, make the discussion, have the symptoms, and then go on HRT if that's what you want. But it's important to rule out any other causes of your symptoms. But really, the perimenopause is going through and diagnosing it specifically based on your symptoms. So there is talk about the FSH blood test, but the British Menopause Society talk about actually it's a diagnosis of your symptoms.
I
So
see.
if you are struggling, it's worth going to speak to your doctor and discussing your symptoms. And it's a really good idea to write it down on a post-it note, take it with you, because then we go in, we struggle with brain fog, we have anxiety, we have a short amount of time, we feel nervous to try and get everything out in that time. So if you can scribble it down and have a list, then it's so much easier just to communicate that with your doctor. If you go in and say, these are all my symptoms, and I think I might be in the perimenopause, it's so much easier to say, great, let's do some monitoring bloods to make sure it's not something else. And then if you want to start HRT, then let's go down that route.
Excellent. Most people would tend to go to Dr. Google
I
to
think that's excellent. I mean, there's so much knowledge out there, and I think there's no harm. I never tell any patients, my gosh, you shouldn't be doing that. However, there is so much misinformation on the internet. Anyone can post anything and update the internet. That's where the worry lies with misinformation. And this
Indeed.
dates back to that study they did in 2002 that told everyone if you take HRT, you're going to develop breast cancer, which has been horrendous for women and given HRT such a bad name and reputation. So there are really reputable sources out there. The NHS is still very good. There's really good doctors that are only based on evidence. But it's a good idea also to talk to your family, speak to your mum. When did your mum go through the menopause? Speak to your sisters, your aunts, friends. What are they doing? What do they feel? What are their symptoms? What have they started? I think that's a really good place to start. But if you did want to go down the HRT route, and it's not for everyone, I must say that. But if you did want to go down the HRT route, the most important thing to do is to go to your doctors with the information that they will require so that you can leave with a prescription if that's what you want. So your doctor's going to want to know your blood pressure. And that could be a reason why they delay prescribing HRT because they want all the information. So if you go with all the information, then they can leave having prescribed you what you need. So go in with your blood pressure, go in with a short family history from your mum, take with you a post-it note with your symptoms, and know the roots of HRT so you can leave with what you want. That's what I advise all of my patients.
You speak of HRT, as you mentioned, so much misinformation. What would be the ABCs of HRT?
So, the first thing to remember about HRT is that HRT is different to hormonal contraception, and there is a very different structure. Contraception for years has been a different, it's not bioidentical. HRT is bioidentical and the same structure as the hormones in your body. And that's a huge differentiation. So, with contraception, there are risks involved, such as clots and stroke, versus bioidentical HRT has much lower risk. So when you know that, you're replacing something that's declining naturally in your body with much lower risks than the alternatives. That's something to feel very comfortable about. The next thing to remember is that there are such fluctuations in your hormones, this zone of chaos with your estrogen that could spike and decline and go up and down. And so it's really hard in this perimenopausal period before everything fully declines to the menopause. So, in that time, one of the most important things is to prioritize sleep. Do all the natural things first, lifestyle, before you go down the hormones. It's always best to do that first. So, prioritizing sleep is one of the most important things you can do because when we go to sleep, it's not just to rest. When we sleep, we're detoxing our brains. And in order to get a good night's sleep, it's so important to do routine. So we're creatures of habit. So if you go to bed at the same time every night, you have blackout blinds, decrease your coffee after midday, take supplements such as magnesium glycinate, 200 milligrams naturally, have a warm drink, do all the lifestyle. Your body needs to decrease by 2 degrees to get to sleep and maintain that sleep. So if you can ensure your room is cool, have a fan, wear cool cotton clothing, thin duvets, so you're doing as much as possible to prioritize your sleep. That's the first stage. There are lots of supplements that we can take, and there's NHS guidance on their website about the benefits and what supplements like black cohosh, which increases your bioavailability of natural estrogen. But all the evidence points towards HRT is much better in all the trials they've done as evidence-based versus supplements, which have not had as much research in them. So supplements, going to bed, routine, sleep, diet. So if you can make sure that you increase your protein, increase your good fats, decrease your carbohydrates, processed food, that's going to be better for you in all aspects, not just in the perimenopause, but just as a good GP promoting health. And then moving. If you can move a little bit more today than you did yesterday, that's always going to be good for you. And I said, cheat your way in the perimenopause. So I have a standing desk at work. I also have a standing desk at home with a treadmill, a walker underneath it. So in the morning when I'm doing meetings, I stand. I walk when I'm on this walker. And I even, to really, be an A-star student, I wear a weighted vest. So I have resistance training whilst walking. And before you know it, you've done 2 hours of steps plus you've been standing. And if you hydrate, then you are not having to go to the gym, you're not having to go and work out and take extra time out of your day to do all of those lifestyle things. So to cheat your way into the perimenopause by doing all of those things, and then that way you're not even going near HRT, but you've done all the lifestyle measures first.
That is a workout for some people who have started late or who don't want to consider exercising. But and for those who have done everything and all the above that you've mentioned, when would be the best time to see their GP for further consultation?
I never think it's too early. So when you think about hormones, your estradiol, progesterone, and your testosterone, they're decreasing and they can be decreasing for 10 years before you hit the menopause. The average age of menopause is 51. However, it is so individualized. So if your mum went through the menopause in her late 40s, or let's say 45, you tend to go on a trend with your mother. So you can be going through the perimenopause in your late 30s. And people are so stigmatized and concerned and worried about the word perimenopause and menopause, thinking, well, no, that's for older women. That's not for me. I'm in my late 30s. It's very scary, in fact, to hear those words. However, you could very much be going through the perimenopause in your late 30s. All it is your reproductive hormones declining over a possible 10-year period.
That's a lot of information that many women don't have ready to them. And I know that we haven't covered everything. If there's one thing you would want every woman to know about perimenopause, what would that be?
For so many years, women have been last. We are last to go to the doctors to get any help. It's been so many years that there's been such a shift of lack of funding, a disproportionate amount of funding into women's health and also the studies. So it's finally time for women to put themselves first, put their life jacket on first. And I don't want women just to be getting through the day. We want to be thriving versus surviving. So the one thing to do in the perimenopause is to start putting yourself first. Start with lifestyle, prioritizing your sleep and all the other aspects of lifestyle, and then book that appointment with your GP and have a discussion and take all the information with you so that they have the equipment, the documentation, everything to leave with a prescription of HRT if that's what you want.
Excellent. Thank you, Nadia, so much for all the information that you've provided, all the education you provided for perimenopause.
Thank you. It's been an absolute pleasure.
Listening to Health and Wellbeing featuring local NHS GP Dr. Nadia Ramjohn here on West Kent Radio. I'm Mona Channet. Next month, we'll be continuing the conversation by exploring menopause itself, what it actually means and how it differs from perimenopause, and some of the symptoms and misconceptions many women still aren't aware of. For more health insights, you can also follow Dr. Nadia Ramjohn on Instagram at Dr. Nadia_perimenopause. And remember, always speak to your GP or healthcare professional before acting on any medical information discussed.